Hey everyone, welcome back to Nurse Crit. My name is Chasen. I'm an acute care nurse practitioner. In my last video, I very briefly mentioned something called push dose pressors. You may or may not be familiar with this intervention, so I thought I would expound on it a little bit more. It's such a valuable tool to have in the critical care arsenal. The objectives of this short video are to understand the purpose of push dose pressors and learn how to properly prepare and administer push-dose epi. First and foremost, I want to make a disclaimer here. Nurses are the primary target audience for my channel, but what I'm about to discuss today is somewhat outside the scope of nursing practice. This isn't something nurses should be brazenly doing on their own. I am teaching on this topic so nurses can be familiar with this intervention and can assist a provider who may want to use it in an emergency. Please do not start practicing outside of your scope and jeopardizing your nursing license. So what are push-dose pressors? Well, all critical care nurses know what vasopressor drips are. We use continuous vasopressor drips to maintain the blood pressure in sick, hypotensive patients, and this is the standard of care practice. But sometimes patients who are not already on vasopressors can suddenly become hypotensive, either from clinical deterioration or something iatrogenically from some other medication we just administered. Depending on the logistics of your hospital, or if the patient is crashing outside of the ICU, obtaining a vasopressor drip may take considerable time. In resource-limited hospitals or those without a pneumatic tube system, it could take, 30 minutes to get a drip from pharmacy, and your patient would be dead by then. This is where push-dose pressors can save the day. Instead of the traditional vasopressor drip, a medical provider can rapidly mix up vasopressors in a syringe where they can push small aliquots to raise the blood pressure. It's especially useful if there is a patient who needs to be emergently intubated but is hypotensive. You can't safely intubate until you get that BP up to a safe range, and push-dose pressors are a quick fix. Understand that push-dose pressors are merely a rescue intervention until fluid boluses can be given or a vasopressor drip can be started. Some of you nurses may work at high-performing hospitals with push-dose pressors readily available, but I assume that the vast majority of hospitals will need to prepare them at the time of need. If you are an MCRIT member, you have access to the website and podcast that covers this. But for those of you who are not members, I will do my best to explain it to you. Like I mentioned in my disclaimer earlier, hopefully a pharmacist or the physician themselves can mix up the push-dose epi. But maybe the doc is busy and will ask you, the nurse, to draw it up. What you need is 1 amp of cardiac arrest epinephrine. This is that 1 milligram in 10 ml ampule that is in every crash cart, and it must be this exact concentration. You also need an empty 10 ml syringe, a needle, and a saline flush. What you are aiming to do is combine 1 ml of epinephrine and 9 mLs of saline into the empty syringe. This recipe yields 100 micrograms in 10 mLs of saline, but more specifically, the concentration is 10 micrograms per ml. If you have any experience with an epidrip, you know we give anywhere from 1 to about 20 or 30 micrograms per minute. So this 10 micrograms per ml dosing is within the range we would be giving as a drip. When preparing push-dose epi, you might be thinking, why not just squirt 1 ml of epi into a saline flush syringe after expelling 1 ml? Well, yeah, that would definitely be the simplest thing to do, but it's considered bad practice by pretty much every authoritative nursing and pharmacy organization to ever put meds into a pre-filled saline flush. Do what you will, but as an upstanding member of the nursing community, I cannot openly endorse this practice. A couple more reminders: be sure to clearly label the push-dose epi syringe so there is no confusion and no chance for med errors. And if the entire syringe happens to get used up, get a new syringe. Never reuse a syringe whose plunger has already been fully depressed. It's no longer sterile at that point. Please watch my other video on IV therapy where I talk about that issue. Now that you have helped the physician mix up push-dose epi, he or she will ideally be the one to administer it. But if that is not feasible for whatever reason, they may ask you to administer it. Do not do this without the explicit direction from the physician. Remember that the final concentration is 10 micrograms per ml. Connect the push-dose epi syringe onto the Y-site port of a fast-flowing saline infusion. If not, you will have to flush the saline lock after each mini bolus you give. You want to push 1 to 2 mLs, which equals 10 to 20 micrograms, every minute until you reach a stable blood pressure. Epi has a very short half-life and will start to wear off in a matter of minutes. Keep cycling the BP cuff every minute if you don't have an arterial line, and administer those 1 to 2 mLs as needed. Hopefully, you will have a vasopressor drip in hand before you use up the entire 10 ml syringe, and you can resume your normal nursing practice with an IV pump. In the end, be sure to document the total amount of epi administered and that you pushed it under the direct supervision of the provider. I have personally witnessed push-dose epi save many crashing patients. I knew about this intervention as an RN, and I quickly mixed it up when we had a crashing patient. I asked if the physician wanted to use it, but he poo-pooed it because he wasn't familiar with it. I explained it to him quickly, then he gave his permission to administer it, and we stabilized that patient with the epi and eventually fluids. A little later, when that patient started to become hypotensive again, the doc asked if I had any more push-dose epi to give. I guess he decided it was a good idea after all. Knowing about this intervention and sharing it with the team helped to save a life that night, and I hope sharing this knowledge will help you all save some lives as well. I love that as an NP, I can now independently use this if the situation requires it. If you have any questions about push-dose epi, please leave them in the comments section and I will do my best to answer them. If you found this video helpful, click the like button and consider subscribing to my channel so you don't miss out on future videos. Thank you so much for watching, and I hope you will join me in my next video. Until next time.